Hello, my name is Jara, and I will be doing one nursing skill. It's called the initiating a peripheral venous access IV infusion. So for this one, we are doing a intravenous access just to prevent or correct some problems in our fluids or end therapy, usually some electrolyte imbalances. So for my equipment, I will be using a IV solution as prescribed. So check on your chart, just verify there. My CMAR or my MAR, my medicated administration record, and a towel or disposable pad. IV administration set. Just pretend that this is my IV set, and some labels for my infusion. Transparent site dressing, but in my case I will be using a IV start kit. Usually it already have the dressing, the gauzes all sterile, and some tape dressing, everything that you need to start the infusion. So I also have a tourniquet here, and some other things, alcohol wipes or alcohol swabs to disinfect my area, my site, an IV catheter or a butterfly catheter. So usually it comes with the color. So in my case, I'm using this pink one. Those colors signify some the gauge of your needle, the extension tubing. I have micropores just in case, blunt scissors, my gloves, my clean gloves. So a normal saline would have about 2 ml in here for flushing, and then my electronic infusion device on the side, some chlorhexidine swabs or cleansing swabs, and then end cap external tubing, and also local anesthetic if needed. So just check on your doctor as well. So for my assessment, first I would like to review my patient's baseline data, which includes vital signs, the input and output balances, some lab values, serum electrolytes. Just check on the lab values, check on the appropriateness of this procedure, and also the solution that you're going to be using. Then you want to assess the arm of your patient for the IV site. Usually it goes with it could go in a cephalic vein, the accessory cephalic vein, metacarpal, or basilic vein. So in my case, I will be using the hand of my patient, the metacarpal dorsal vein. So I would just locate that area. These are my veins here. So I'll just locate the most accessible site, the vein. Usually it's a little bit more straighter line, so I will check on that one. And then so you would like to do that IV just above, about 2 inches above the crease of the wrist. So just make sure of that consideration as well. So for my nursing diagnosis, I could have some nursing diagnosis like deficient fluid volume, some risk for injury because we're perforating a tissue, risk for infection, impaired skin integrity, risk for deficient fluid volume, and of course we're doing some needles, so anxiety as well for the patient. So for my implementation, I would like to verify the IV solution from my notes, from the doctor's order, just to make sure that there's no errors and you can clarify it at this moment. And then check on the MAR, the CMAR, what medication you're going to be taking out, and also check for the allergies of this patient, if this IV infusion is even indicated for the patient, the solution, especially if there's any allergic reaction on that. And then you should know, as a nurse, you should know the techniques, the nursing consideration, the special consideration when doing this procedure, precautions, the purpose of the IV, and some of the medication that we're going to be injecting to the patient. So of course you would like to gather all your equipments in the room. That way it prevents you from straining your muscles, going back and forth to the supply rooms. You want everything by the bedside. That way it's easier for you to access. It saves time and energy, and also it's convenient for the patient as well. And then next one, you're gonna perform your hand washing technique. So I'll wash my hands, do my proper technique with soap and water. That way we don't cross-contaminate the patient, and also prevent some spread of microorganism. And then I would like to identify the patient. So for this one, I would verify the patient's full name and the date of birth. So those are my two identifiers. And then after that, you would like to provide some privacy for the patient. So close your curtains, the doors, make the patient feel comfortable. That way it would reduce some anxiety when doing this procedure. And then just explain to the patient what you're going to be doing, the purpose of this procedure, the benefits, and what not to do, precautions and all that. That way you'll establish rapport with the patient, and at the same time you'll gain that trust, and the patient will be more comfortable. And then if using some local anesthetic, just verify that one, and then explain to the patient that you're going to be using that. That way it's more comfortable for the patient as well. So to prepare your IV solution and administration set, you would like to compare your IV container label with the CMAR or the MAR. So you would like to verify, that way you know what the solution you're going to be using based on the doctor's order. Just compare it with your CMAR, and then just remove the bag from the wrapper. And then, so this is my bag. Just check the expiration dates, the labels, the time and date. Just put all of that together. That way we have an indication what are the information needed for this procedure. So the dates, the expiration, the label of the solution, what kind of solution you're using, and then the time and the date. And then when you're opening any sterile equipment, you would like to maintain a sterile environment as possible. So maintain the aseptic technique when doing any sterile packages. The IV solutions, you want to check on the label, and then you label the tubing as well with the date and time. Usually for our IV solution and our IV in general, we want to only use it for within about 72 to 96 hours, because we need to change it after that. Otherwise we're going to cause more problems or infection for the patient. And then so you would like to close the roller clamps on the tubing. That way before we insert this one, we want to close it on this and then slide the clamp on the administration set. And then invert the IV solution, and then just insert the spike. So let's just say this is my IV solution. Usually this one have like a spike in there, so you would like to insert that at the end. And then just place this one in your IV pole. And then just take out all the air bubbles as much as possible. Just try to let it drip until you don't see any air bubble. That way you will eliminate some of those air bubbles, because those can also cause some embolus. So you would like to prevent that from happening. And then so if you have an electric device, just get that prepared, and then check on the manufacturer's instruction when you're doing that one. So to initiate a peripheral venous access, I would like to position my patient in a low Fowler's position, and just make sure that they're comfortable enough when they have this position. Just provide them some pillow and blankets. And then just make sure that you place your disposable towel underneath the patient's arm. That way you could prevent any spillage of blood into the linens. And then just provide some emotional support if needed for the patient. If they're feeling some anxiety, just let them know that this would hurt, but we will try the best possible way to make them comfortable. And then after that, you would like to open the short extension tubing. So I would open this tubing and then prime it. Just put your normal saline and flush it in the lumen, and just make sure that everything is there. You take out some bubbles, and then just put it back into the just put it back into your container, and then just put it aside within reach. After that, just select the patient's vein. So when you're selecting the patient's vein, you would like to see on their metacarpal, the vein that's a little bit more straight. That way it's more stable, because you know, the hand flexes. You would like a straight vein as much as possible. So in my illustration, I would use this vein here, so that it also follows the contour of the needle. And after I select that vein, I would just like to put on my gloves. And if the arm is hairy, you would like to clip that area about 2 inches around it. But in my case, the patient doesn't have much hair, so there's no problem on that one. So I would put my gloves on. I would put my tourniquet about 3 to 4 inches above the IV site. So just make sure that you put the tourniquet appropriately, not too tight that the patient's hurting, and not too light. So just enough to distend the vein. The purpose of that is to distend the vein and to obstruct the blood flow of blood, and let the patient open and close their fist. That way it's more visible for you to see the vein there. And then if it's not, the vein is still not visible, you would like to also provide some warm compress on that area, about 10 to 15 minutes. Just put the warm towel on top, then just get back to it. And then or you could also massage that area until the vein pops out. And then after that, so now the vein is more visible, I would get my chlorhexidine swab, my antimicrobial swab, and swab it on that IV site. Just front and back motion, scrubbing motion, very gently, for about 30 seconds. That way, most of the microorganisms is going to be eliminated in that area, so we could maintain a sterile environment as possible. And then just throw that into the receptacle, and with your non-dominant hand, you would like to grab the patient's hand about 1 to 2 inches below the IV site, and just, you know, taut the skin. That way you would see more of the vein and the axis there, and it's more stable that way. So just instruct the patient not to move or not to do any unnecessary movements when we're doing this procedure, because we're inserting a needle. So after that, you would like to grab your IV needle. So let's just pretend this is my needle. I would put the bevel up, and also do about 10 to 15 degrees angulation when inserting this needle. So gently insert the needle to the prepared site, to the vein that you selected. And then as soon as you insert the needle, you would see you would feel a give sensation when you're in the vein already, and then you will see a backflow of blood. So just make sure that you check on that one. And if you see that backflow of blood into the lumen, you would advance the needle a little bit more. That way you could secure that needle there, and just make sure that you put your stabilization skin protectant tape, and then take off your tourniquet as soon as you insert the needle there, because you don't want that you don't want to maintain the obstruction of blood flow. You would like the blood flow going again. So get your tape, and then just secure this area here. Just make sure that you hold the hub of the needle, so you could free up one of your hand, the dominant hand. And then just get your external tubing, and then attach your tubing onto the needle, and then you know, just get your sterile saline, and then flush that tubing again, and see if there's any leakage or any infiltration before you even hook it up to the IV pole. So I determined that there's no leakage or any infiltration. So I would prepare my dressing onto my arm, and then I would put my transparent dressing over just to stabilize this area here. Just make sure that instruct the patient to safeguard this area. And then after that, I would insert my IV administration set to the external tubing, and then I would clamp it up and adjust the clamp into the appropriate flow rate. So just make sure that the flow rate instructed is given to the patient. And then as soon as I put my my stabilization device as well, so that this area here is more stable from any movements, and then take off all your PPE. Take off all your PPE, take off all your equipments that you use. Just toss it into a proper receptacle. If you use some smart containers, just put it in your sharps containers, and also the biohazard bin. So take it out, and then take off your gloves. These are dirty now. And then just evaluate this area after 30 minutes of putting the IV infusion device. And then after that 30 minutes, just do it 1 hour thereafter. After that, evaluate the patient to see if we've successfully done this procedure. The patient's feeling comfortable, the anxiety was decreased, and we were able to successfully do this procedure. And then we document all our findings, all our procedures, all of the equipments that we use, the site, the route, the time, the date. And then just make sure when you're doing this, you would label all of your IV site, and also the administration kit, and also the solution. Just label it with the route where you put this IV, and also you would label it with the time, the date, the flow rate, the solution that you used, and all those things, because that way the next person that's going to do this again, because this one is only good for about 72 to 96 hours. So after that, you would need to change it. So you need those labels just to make sure that the next person that's going to do this procedure is available. All this information is available for them for easy to get all the equipments needed. So that would end my IV infusion, venous access, and thank you and have a good day. Bye.